What's the truth about anal sex, and how can you practice it safely? I'm Dr. Rena, a urologist and pelvic surgeon, and today we're going to walk through everything you should know about anal sex. Anal sex involves inserting a penis into a partner's anus. People may choose it for sexual enjoyment or as a way to avoid unintended pregnancy, and it's becoming increasingly common among younger heterosexual couples in the United States. Studies suggest that around 37% of men and 30% of women have tried anal sex. And when looking at broader research, about 10% of sexually active women report engaging in it on a regular basis. For some, anal sex feels more intimate than vaginal intercourse or other types of sexual activity. Others appreciate the sense of variety or newness it brings. Some individuals find excitement in doing something considered more taboo, while others are drawn to the sense of control or dominance they associate with it. There are also people who enjoy the unique mix of discomfort and pleasure it can create. And for many, it's simply a natural part of their relationship with their partner. Interestingly, anal sex among heterosexual couples has been represented as far back as 300 AD, appearing on Peruvian pottery. It was also illustrated in Chinese hand scrolls and prints during the 16th and 19th centuries, and later in French lithographs and photography in the 19th and 20th centuries. So this is not a new practice. It has existed for a very long time. So, is anal sex safe? Yes, when practiced properly and with the right precautions, it can be quite safe. But what exactly do you need to know to make sure you're doing it safely? First, and most importantly, you and your partner need to be on the same page. That means having open communication, and it's not always just about words. You should also pay attention to their body language and subtle signals to truly understand whether they're comfortable and willing, or if they might feel pressured. Another key point is that the anal canal does not produce its own lubrication, so using plenty of lubricant is essential. But one important thing to remember is that the pH of the anus is different from that of the vagina. Because of this, water-based lubricants are usually recommended for anal sex. Keep in mind, though, that water-based lubricants can dry out, so you may need to reapply. Other options include silicone-based or oil-based lubricants. You might wonder why a condom is necessary since there's no risk of pregnancy with anal sex. As I've discussed in another video, even though the FDA has approved certain condoms specifically for anal use, the bigger concern is the risk of sexually transmitted infections. This is especially important because many people don't use condoms during anal sex. The tissues in the anal area and the lining of the rectum are very delicate and can tear or bleed easily, which increases exposure to bodily fluids like blood. This can lead to the transmission of infections such as HIV, HPV, syphilis, gonorrhea, and chlamydia. If you're unsure about your partner's STI status or simply want to protect yourself, using a condom is strongly recommended. For oral to anal contact, a dental dam can also be used. Regardless of whether you choose to use a condom, always use enough lubricant to ensure the experience is both comfortable and safe. And if you switch from anal to vaginal penetration, make sure to change condoms. Remove the one used for anal penetration and use a fresh one for vaginal intercourse. So, what about using toys? When you're just beginning to explore anal intercourse or anal play, it's often advised to start with something smaller than a penis. This could mean using a well-lubricated finger or a specially designed sex toy. Now, what types of toys are safe to use in the anus? There are products specifically made for anal play, and these usually come with a flared base, a ring, or a string at the end so you can easily remove them. Those are the ones you should stick with. There are many options available, such as butt plugs, anal beads, and dildos, but it's important to make sure they are clearly intended for anal use. You should avoid using toys designed only for vaginal use that don't have a flared base, because they can accidentally get stuck in the rectum. After using any toy for anal play, always clean and sanitize it thoroughly before using it again. If you ever feel pain during anal sex, it's very important to stop, especially if there is noticeable bleeding or discomfort that doesn't go away. While it's quite rare, injuries to the anal sphincter can happen. This muscle ring around the anus helps control bowel movements, and if it's damaged, it can lead to issues like loss of control over stool. Again, these situations are uncommon and usually happen only when anal sex is not practiced safely, such as not using enough lubricant, ignoring your body's signals, or pushing forward when your body isn't ready. I hope you found this information helpful so you can enjoy safe, comfortable, and pleasurable experiences with your consenting partner. And as always, stay safe, stay healthy, and take good care of yourself, because you matter.